non-invasive procedures that are breaking ground in the world of anti-aging. Music to our ears. Dermatologist Dr. Lisa Kellett, everyone.
Thank you.
So, lots of stuff happening. The future's looking good.
Oh my gosh, the future's looking good for us old ones.
Yeah,
yes.
for us old ones.
Yeah.
So there's a lot of new and non-surgical procedures that are happening.
Absolutely.
Now, you're going to show us 3 innovations in non-invasive anti-aging procedures. The first one is eDermaStamp. This is groundbreaking. Never seen before on television until now, right? So, Rose, come on in, Rose. And Rose is going to try this procedure. You signed up for it. How are you?
Great.
Why do you want to do this?
So I'm noticing I have a bit of a more tired look and some fine lines around my mouth and my eyes.
Right, right.
I'd like to freshen up and have a little bit of a...
That's the word, though. Freshen up, freshen up. Okay, you sit down. You've done this in rehearsal. You tell me what you need to do. Okay. And what are you going to do, Dr. Kellett?
Okay, so for Rose, typical patient. And her concern is some lines around her mouth and around her eyes.
Right.
Doesn't want to do surgery, might not want to do any fillers or anything like that, but she just wants to look a little bit fresher.
Okay.
So new system, eDermaStamp. And what it is, it's a handpiece, and on the tip of it are needles, tiny surgical grade needles. And what they do is they are inserted into the skin up to 150 times a second. It's called collagen induction therapy, and what that does is it goes into the skin and causes collagen regeneration.
Wakes it up.
Absolutely.
Okay. Well, first of all, I want to say that you have good skin to begin with. You would agree with that, right?
Thank you.
So you just can't come in and just do this overhaul without having some good skin to, like, taking care of your skin as much as you can.
Absolutely. And you know, you come in, you see a dermatologist.
Yes.
You do a proper assessment.
Right.
Physical exam.
Right.
And then you discuss kind of what are your concerns, and then we go over the risks and benefits and what you can expect from therapy.
Okay, take it away.
Yeah.
Here we go. Do you want me to hold your hand, Rose? Please.
Okay.
Is it going to hurt, Dr.
So I'm going to put a little bit of,
Okay.
this is a little bit of hyaluronic acid, which is give us a little bit of slip here. We'll put this in the skin. We'll do around her eye here. And once again, it's called collagen induction therapy.
Okay.
And what this will do is I just do it in small circles. And as I'm doing this, she's actually getting these tiny surgical grade needles that are inserted into the skin, and they are causing collagen regeneration.
You mean it's like penetrating the skin?
It is very, very quickly.
She is not flinching at all.
No, it's a great therapy. Great for, as I said, the lines around the eyes, around the lips.
And after she gets this done, is there redness after this for a little bit?
She might be a little bit pink. It depends on what grade of wrinkle she has and what scar she has.
And is there downtime?
Maybe 1 to 2 days.
Okay. And stay out of the sun always?
Always stay out of the sun.
I know,
yes.
I know. And then is it like a one-time treatment?
It depends on the grade of wrinkles and the grades of scarring. So we also use this on scars.
Okay.
And we are able to do multiple sessions. It really depends on what the patient has.
Right, right.
And that's it.
That's it. That's all it takes. Didn't hurt, did it?
Not at all.
Boy, that is great to know. Isn't that great to know, everybody? But it didn't hurt. Thank you, Rose. Thank you, sweetie. We'll give you a Kleenex. So she's going to wipe that off? She is? Okay, all right. Very good. Okay, now we're going to see a before and after shot of what?
Yes, so the first one we're actually is going to look at what we just did.
Okay.
Okay, so this is interesting because if you look at the top, you know, this is probably a pretty typical patient.
Yeah.
But you look at the skin and it looks a little bit dull.
Yeah.
Okay, look at the bottom picture and you can see there's actually luminescence.
Yes.
So the light is reflecting more uniformly off the surface of the skin. And the eDermaStamp is good, once again, for collagen induction therapy, good for wrinkles and fine lines.
How much does it cost?
About $600 and up.
Okay, but you get that luminescence, and how long does it last?
As long, yeah, it's fantastic.
It's like a long time.
Yes.
Okay.